Welcome back. With me today is Dr. Kenton Shaw, and he is a gastroenterologist at Memorial Care Saddleback Medical Center. Nice to have you on, sir. Welcome.
Thanks for having me, Ken.
We were talking that you said about a year and a half ago you were on the show that we used to do with Monarch.
That's right.
And so you've been here before.
Yes.
Great to have you back. And today we're talking about a new procedure for GERD, G-E-R-D. So I am going to let you pronounce that, what it is. I mean, I've heard of GERD before, but let's kind of get a background, what that is. Is it something that is chronic? Can it be helped? What causes it?
Sure, great question. So GERD stands for a gastroesophageal reflux disease, and it happens when an abnormal amount of stomach acid travels up the esophagus and results in symptoms such as heartburn, regurgitation, sometimes difficulty swallowing. And it happens when the valve between the esophagus and the stomach becomes too loose. Normally this
too loose. Okay.
Normally this valve allows food and liquid that we consume to go down into the stomach, and the valve prevents food and liquid and acid from coming back up in the esophagus. But when this valve becomes too loose for various reasons, then abnormal amounts of acid travel up the esophagus and can cause problems.
Okay, now I would assume that for the average person, it's normal for us to have something like that happen once in a great while, just for whatever reasons. But this is something that will happen frequently or almost on a daily basis to someone, right?
Correct.
Okay. How does this happen? How does the valve get loose? Is this just something that it's kind of you're born with in a way, or you're something that's like anything else? You know, some people, they have to wear glasses earlier in life than others.
The minority of cases it's that way, but it's actually mostly a preventable process.
Is it really?
And it's often due to obesity or being overweight or chronic overeating, chronic heavy lifting or straining, pregnancy, childbirth. So anything that increases the pressure in our abdomen ends up stretching that valve, and then consequently allows acid to go up into the esophagus.
Now, is it something, let's say in the case of childbirth, is that something that is temporary? Maybe for the first few months afterwards that'll happen to a woman, and then it kind of goes back to normal? Is it something that once it happens, it's there to stay?
It could be either way. As most pregnant women can tell us, they often have acid reflux during pregnancy and shortly after pregnancy, but there are plenty of patients who end up with long-term acid reflux after their pregnancy, unfortunately.
Okay, so let's talk about, there's other symptoms that go along with this as well. Irritable bowel syndrome, and even colon cancer screening can help with this, or am I right?
Yeah, well, other symptoms involved with acid reflux not only involve heartburn and regurgitation. Those are the kind of typical or classic symptoms of acid reflux, but there can be some atypical symptoms of acid reflux as well, including upper abdominal pains, chest pressure, even chronic cough or sore throat or hoarseness can be symptoms of chronic acid reflux. And so patients often deal and suffer with these symptoms for long periods of time, even before knowing that they're due to acid reflux.
Okay, so let's talk about this new procedure. It's called TIF, and how this helps out.
Yeah, so it's a very exciting new procedure. It's actually not that new anymore. It was FDA approved in 2007. It's been performed in this country over 20,000 times. And TIF stands for transoral incisionless fundoplication. Okay. So transoral, meaning through the mouth.
Yeah.
Incisionless, exactly as that sounds, it's an incisionless surgery through the mouth. Fundoplication describes the type of surgery, which is where we wrap the top of the stomach around the bottom of the esophagus to help reconstruct that valve that becomes too loose over time.
Wow, so this isn't something like a little implant valve that you put in. It's not a valve replacement.
It's not. We go through the mouth with a camera called the endoscope, and we use a device called the esophax device, very catchy name. And when we are in the stomach, we retract the tissue from the top of the stomach to lengthen the valve that becomes too loose and too short, and we wrap it around.
Is this a
yeah, this
video?
is a
Okay.
this is a diagram of the procedure. So we retract tissue to lengthen the valve. We wrap the tissue around the bottom of the esophagus, and we fasten it using these polypropylene fasteners that are shaped like an H, and they look like the fasteners that attach our clothing tags to our new clothes, and they're as strong as 3/0 sutures, and it helps us reconstruct the valve by tightening it and lengthening the valve.
Very interesting. Now, as far as the length of time of recovery, does a person have a certain amount of time that they can only have liquids or something like that?
Absolutely. So this is surgery, though it's minimally invasive surgery. So there is a recovery period. Most patients are able to go back to work the same week. So they take maybe 3 to 5 up to 7 days off of work. They need to be on a liquid diet for a couple of weeks, a soft diet for several more weeks, and they have some activity restrictions as well for several weeks. So it is a similar recovery process as surgery, though shorter and usually less painful.
So what is the percentage of patients who have GERD that would need this? Would this be more of an extreme case?
Not necessarily. We actually recommend this particular procedure for the mild to moderate patients with acid reflux. And the reason to get this procedure would be really anyone with chronic acid reflux who requires chronic acid reflux medicines. And there can be various reasons that a patient would want to get this procedure. Number one is if their medicines are providing incomplete relief of their symptoms, or number two, they have reasons to come off of their medicines if they're afraid of long-term side effects of the medicines, which there are increasing concerns of, or if they've already experienced side effects from the long-term medicines.
All right, very good. Now, as far as people coming in and you figuring out, yeah, they really do have GERD versus maybe something less invasive, less mild, or more mild, I should say. What are some of the things that you do? Do you just sit down and talk to them and ask them, is this something you go through every day? Could it be maybe something that's temporary through stress? How do you come about like, yeah, this is, you really have GERD and this is something we need to further look into?
Well, to qualify for a procedure like this, a patient should have had reflux symptoms, regular reflux symptoms for at least 1 year and require daily acid reflux medicines for at least 6 months. It should be bothersome enough for them to want a procedure like that, which most patients who come to me end up having very bothersome acid reflux. And they often need to go through an upper endoscopy to evaluate their anatomy, to evaluate this valve, see if there's any short-term or long-term damage in their esophagus from acid reflux. And of course, we ask them about their symptoms in terms of the duration, the frequency, the severity, and the types of symptoms they have. All
right, very good. I want to give you the website that you can go to and find out more information. It's memorialcare.org/TIF, because that is the initials for the procedure. The number is 1-800-MEMORIAL. That's very easy to remember as well. Dr. Shaw, great information. Thank you very much.
Thank you for having me.
It's nice to see that always coming up with new procedures that work better than the previous ones.
It's very exciting.
Thank you very much.
Thank you very much.
Take care, doctor.
You too.
We'll be right back.